Elsewhere, drug abuse among young people in Nigeria seems to have worsened in recent years and is rapidly reaching endemic levels, especially in remote corners of the country's major urban centers. In these places, adulteration and abuse of illicit substances are usually passed off as insignias of social standing, a means of making brisk business, while groups and concerned individuals are not letting the situation overwhelm them as they continue to spread their dragnet across the length and breadth of the country. Joining us now to talk about this for a while is drug abuse expert David Folaranmi. Good to have you with us, David. So, where is Nigeria conducting drug abuse among young people currently?
Sorry, I didn't get that. I didn't get the question.
Where is Nigeria, combating drug abuse, among young people currently, you think?
Where is Nigeria ranked in combating drug abuse among young people? Indeed. Is that what you said?
Where are we exactly with that?
Oh, okay. I think currently we're doing the public sector under the leadership of Brigadier General Buba Marwa, retired, who heads the statutory body in charge of drug demand supply and drug demand reduction. The NDLEA is doing an excellent job in combating the drug abuse scourge among the youths in our country. We know that the most recent statistics from a survey from the United Nations of Crime stated that we have a prevalence of 14.4%. That's about 14 million Nigerians between the ages of 15 and 60 who are abusing drugs. This was in 2018. We know that this number, because I believe more organizations in the private sector are coming together to join in this drug abuse in our country.
David, it's unfortunate that social media has made drug abuse look almost cool, whereby we see people that probably engage in these vices and they seem to be catching the high or probably chasing a high, and people probably laugh or people just probably take it as one of those things that you do. How is social media actually fueling this drug overuse and abuse here in Nigeria?
Thank you. The media in general, mainstream media, social media, has a way of glorifying drug use, making it look cool. And then because we have so many millions of youth who are hinged on social media, by the time they keep saying these things repeatedly and the way it's been portrayed, making it look like it's very good and very cool and has no side effects, because social media would hardly show you the side effects or the repercussions of these drugs or the abuse of this. Show you the part where there's the euphoria and there's the ecstasy, and then the young minds who do not have proper will tend to follow through and get hooked up on these drugs.
Very good, David. Now, is drug counseling any help, and which institutions are saddled with that responsibility of that in that regard?
Drug abuse counseling and therapy provides a lot of help to people who are struggling with drug use. First of all, I would also start again with the NDLEA, who provides drug counseling and therapy across their commands in the country. But then we also have the private sector. We have rehabilitation centers with individualized treatment methods. We have sort of my organization here, the Folaranmi Foundation. We have the Food and Genes Initiative that also provides drug counseling and therapy for people who are in need. We have the Dove's Mind Synergy. These are examples of organizations that are providing counseling and therapy, evidence-based counseling that has yielded results in the past and is still yielding results today.
All right, David, let's talk about education and information in terms of drugs, because some people would say that marijuana, for example, marijuana is not as bad as maybe you take probably crack or probably cocaine, because people say that marijuana has medicinal value, and they preach these things time and time again, and they say, and they even support it with the fact that sometimes people are actually prescribed marijuana in the hospital, medical marijuana, and they say, and people probably try to glorify it or probably try to sugarcoat it that all drugs are not the same and they should not be criminalized and put all under the same bracket. Try to help us understand. Give us a little bit of education about some of these things and their adverse effects.
Okay, thank you very much. There's been a lot of talk about marijuana and the potential legalization in Nigeria. I'm one of the people who stood firmly against it and was very, very ecstatic and joyful when the House of Assembly threw that proposed bill out. Now, it's not a lie that there are medicinal values from marijuana. However, as a country, we are not ready to harness those medicinal advantages of marijuana because we don't have the adequate education, just like you said, just like you pointed out. People don't know the adverse effects of the misuse of marijuana. We don't have enough policing to make sure that if these things are legalized in our countries, people are not going to use them illegally. You know, it's just a part of marijuana that is medicinal. That part needs to be extracted, taken through a vigorous process in the lab before it can be used as medicine. However, we don't have that technical know-how. We are not ready for it yet. Research has shown that excessive use of marijuana can lead to severe illnesses like schizophrenia and sterility in men. So the short-term and long-term effects of using marijuana at this point in time in our country will outweigh the benefits if it were legalized. So like you said, we need more and more education to be put out there across all of our youths for them to understand that these things can actually affect them in the short term and the long term.
Very good, David. Now, let's talk about the over-the-counter drugs that may lead to abuse. How do we prevent that? You know, earlier you talked about medicinal marijuana, but there are other drugs, you know, that are seen to be subtle, but when abused, it becomes a problem.
Exactly. We've been in touch with the Federal Ministry of Health from the last administration, and we believe in this new administration we're going to continue our talks on how to police or how to curtail the misuse of over-the-counter drugs. We have so many medicines that are sold over-the-counter that when abused can become a problem. And I believe that strategies are being put in place to make sure that this issue is being curtailed. We have an example of codeine, and when that blew up, the stories blew up about the issues that were codeine and it did not. We found out that the government put a ban, total ban on codeine. Some of these other medicines that are currently in circulation and sold over the counter, we might not be able to put an absolute ban on it, but we're going to see that more measures are being put in place to make sure that our youth don't fall prey to abuse of these substances.
All right. The news, of course, is actually rife right now, talking about over-the-counter drugs and some of them that are being abused. Of course, in the U.S., the U.S. has been cracking down on the Chinese suppliers of the ingredients for fentanyl, and we see these things play out time and time again. And yes, you mentioned codeine. Of course, there's tramadol. There are quite a number of them. But as it still stands, how much work do we need to do with NAFDA? Because we even see some people go around with suitcases selling drugs. So when you're talking about over-the-counter, how do we regulate these things? That these things do not spiral out of control? And which are some of the drugs that are popularly abused that they need to ban at the moment? We know because they've actually put a check on codeine. We've mentioned tramadol and quite a number of them. But which of them do you think still needs to be clamped down on?
Okay, thank you very much. The NAFDAC and NDLEA and other statutory bodies are working hand in hand to see that some of these dangerous drugs are being clamped down on. But to answer your question directly, one other drug that's becoming a pain in our necks because of the rate at which a lot of people are getting addicted to it is the injection called pentazocine. Pentazocine is an injection that's used to treat severe pain, and it's very easy, just like a lot of other analgesics, it's very easy to quickly get addicted to it. And then we've seen persons who are injecting themselves with pentazocine that has been bought over the counter. They've developed sores on their legs or their buttocks where they are injecting themselves and still injecting the drug because of the addiction to it. We've seen people who have been amputated because of the height of the addiction to that drug, and then they have destroyed their limbs because of excessive injecting the drug even when they should have stopped. So this is one example of a drug that I personally have encountered so many issues of young persons who have struggled with addiction to this injection, and I think there should be a clampdown on this particular drug.
Indeed, you're right. Those are stark realities of drug abuse. David Folaranmi, drug abuse expert, I would like to thank you for your perspective on combating drug abuse among young people. It's good to have you with us.